Community Plan, submitted by Wendell Katangay, Herzing University, Community and Public Health Nursing, submitted to Professor Christine Williams. Community and public health play a vital role in health of an individual. Public health nurses assess, develop, plan, implement, and evaluate like what primary nurses do. Systematic approach is the key to effectively identify the need of a community to improve not only the health of an individual, but the whole community. Defining your community. So what is community? It is a collection of people who interact with one another and whose common interest or characteristic forms a basis for a sense of unity or belonging. My community is Village of Norwich, a rural community in the northwest suburb of Chicago with an approximate population of 15,251, a diverse community with predominantly white population. According to statistics, the Village of Norwich has increasing number of older adults and senior population. Windshield survey. Village of Norwich is a small community that has a lot of resources and opportunities for all the residents. A safe place to raise a family. A place where an individual can enjoy both rural and urban type of living. A fast-growing community in terms of all forms of businesses. Comprehensive plan for elderly population. The main objective of the comprehensive plan is to provide continued support to community senior population, allowing them to age in place. Community assessment population, the total population as of April 2021 is 15,251. Average median income is 72,570 per household. There is an increasing number of population in the community. The focus of this project is providing the best care for our elderly by way of providing them proper and correct information. Are my community partners and resources? Community partner versus the home health agency of all family healthcare, Administrator Dorothy Joy Balmaceda, who's a doctor, and with visiting nurse of all family, Norma Soto, licensed practical nurse, and my community resources is the Center for Disease Control and Prevention and the American Diabetes Association. What is nursing diagnosis? Nursing diagnosis helps nurses to see the patient in a holistic perspective, which facilitates the decision of a specific nursing intervention. A clinical judgment on an actual or potential health problem of an individual. It is used as a basis for formulating nursing care plan, interventions, and goals. Nursing diagnosis for my community project. Risk for unstable blood glucose among elderly patients of all family healthcare related to poor eating habits, as evidenced by poorly controlled blood sugar level. Goals and objectives. Short-term goals. The patient or patient's caregiver will have a better understanding of type 2 diabetes mellitus. The patient or patient's caregiver will verbalize understanding of the management of type 2 diabetes mellitus. Long-term goals. Patient or patient's caregiver will be able to verbalize at least 3 lifestyle changes or modification. The patient or patient's caregiver will verbalize understanding on the different complications of type 2 diabetes mellitus. Intervention activities and resources. The nurse will instruct the patient or patient's caregiver regarding the nature and type of diabetes, its progression, and its effect to the different body system. The nurse will instruct the patient or patient's caregiver regarding prescribed medication, diet, and exercise compliance to control blood sugar level. The nurse will instruct patients or patient's caregiver regarding lifestyle changes to control diabetes, such as engaging on physical activities and simple exercises, promoting healthy eating habits, and managing stress. The nurse will instruct the patient or patient's caregiver regarding different complications of type 2 diabetes mellitus when it is not controlled or poorly controlled. The nurse will enumerate few of the most common complications, including diabetic neuropathy, nephropathy, retinopathy, and heart problems. Evaluation. Health information is usually conveyed through patient education or counseling delivered by healthcare providers. Further understanding of educational communication is imperative to assist older patients in performing better self-care. The community project for my type 2 diabetes mellitus is a useful tool for educating the homebound elderly patients that are diagnosed with type 2 diabetes mellitus. Providing proper and correct information remains to be the best tool in providing quality healthcare for our elderly population. In conclusion, community projects are beneficial to the community. It is very helpful and useful in raising awareness, especially for the elderly population who are the most vulnerable. In this community project, it shows us the importance of knowing our community and identifying the resources that the community have for the residents. Nursing diagnosis is also used in the community to set up plans, interventions, and goals to treat and address the community healthcare problems. Providing the community with available community resources like American Diabetes Association and Center for Disease Control and Prevention. Advocating for the elderly population is showing them that the community values them. That's it. Thank you so much. Have a good day.